Good afternoon, everybody. It's so nice to be with you here on this Wednesday afternoon. Thank you so much for joining us over the lunch hour. It's great to be here with Dr. Hoffman and Patrick Geho. I will let them do their own introductions to explain a little bit more about who they are. But I think if we can just jump right into it, then we'll just get started. So, Dr. Hoffman, let's start with you. If you can give me an introduction of yourself, of who you are, how long you've been in Nebraska medicine, and then I'll have a follow-up question for you about your job as well.
Sure, absolutely. So I started here in 2015. I am a kidney and pancreas transplant surgeon. I operate on both adults and children. I have a passion for live donation and pediatric kidney transplant. And I'm really excited to be here with Patrick. So yeah, I'll let him go.
Yeah, okay. Patrick, do you want to tell us a little bit about yourself and who you are and what you do and your connection to living kidney donation?
Sure. My name is Patrick. I am a entrepreneur. I own a wedding DJ business. I've been in that industry for over 20 years. I donated a kidney back in January to my wife's best friend of almost 25 years. That was my first interaction or experience with anybody needing a donor or wanting a donor. And it's actually been for the most part, a really great experience. So glad to be here.
Good. Good. Well, we're so glad to have both of you here today. We're going to be talking about living kidney donation to kind of round out our Donate Life Month. So that's what our topic is today. And I'm very excited to have both Dr. Hoffman and Patrick here to talk with us today. Patrick, since you kind of jumped into that a little bit, tell me a little bit more about what it was like to be a donor and the reason you chose to move forward with donation. So we know that you donated a kidney, but tell me a little bit more about how you knew the recipient, if you started a chain, what the donation process was like, some of that information.
Okay. Well, it's the recipient was my wife's best friend. She actually approached my wife if she would consider being a donor. My wife was ineligible to donate. I don't know the logistics of why. And I was just sitting on the couch and said, well, if she needs a kidney, if they'll take it, they can have one of mine. And she said, really? And I said, sure, why not? And started the process from there. Really had no hesitation the whole way through. I kind of figured that enough of these get done every year that people know what they're doing. I trusted the experts. Dr. Hoffman made me feel really comfortable in our meeting before the surgery, which was just kind of the icing on the cake to go ahead and go through with it. She made me feel really comfortable about the process. And I just had to show up and lay on the table. I had the easy part. So it was really a no-brainer for me.
Yeah, well, it's certainly, you make it sound so easy, but it's certainly something that's very commendable. And on behalf of all the living donors, I want to thank you for what you did. I think that it's really amazing. And despite the fact that you make it sound so easy, I know that it was probably quite a journey. Dr. Hoffman, can you tell me why living donation is so important and why it is so needed right now?
Sure, absolutely. So just in the state of Nebraska, approximately 200 people would need a kidney transplant. And if it wasn't for live donors, everybody on the kidney transplant list would be waiting for a deceased donor. And that can take a long time to come. In fact, patients die every day on dialysis. So people like Patrick who step forward to donate a kidney help immensely. Kidneys that come from live donors tend to last longer. Patients have less incidence of rejection. They recover quicker. They have a better quality of life. Also, live donors can step forward to start a kidney chain. Which essentially starts with an altruistic donor, somebody who comes forward to donate to a stranger, and they can start a chain of events, which allows multiple other patients to receive a live donor kidney. And that also helps alleviate some of the pressure on people who are not able to get a live donor, because if we can take 10 to 12 people off the kidney transplants list, that allows for people who don't have a donor to have better access to deceased donation in the state of Nebraska. So it is extremely important.
Sure. So you brought up one of my backup questions that I had just in case we had some extra time that I was going to bring up. You brought up the kidney chains. And one of the videos that I like to show in my educational presentations with students is the longest kidney chain in Nebraska history. So can you tell me what it was like about that process to be a part of that? And can maybe kind of explain for people who don't know what I'm talking about, what happened and what it was like to be a part of that process, being part of Nebraska's longest living kidney donation chain?
Sure. So the process was both anxiety provoking and exciting. I think people need to understand that in transplantation, the live donor process and the kidney chain process is all about hope. We go into this with a great deal of hope. We have no idea if it's going to work out okay, but we believe in the donors. We believe in people that step forward out of the goodness of their heart to help complete strangers. And the fact that we had so many people trust us. So the kidney chain started with an anonymous donor who came forward to donate to a stranger. And within that chain, there were people who came forward to donate to their recipient, but they were not a match. So they knew up front they were donating to a stranger, and that the person they were hoping to donate to would eventually get a kidney, either on that same day or the next day. The kidney chain ended with donating to a child, which was pretty special. And I would say it was exciting. It was sort of awe-inspiring. And I think it gave a lot of hope to the institution and the state, actually, to know that there are so many amazing people in our state and surrounding states that would come forward to donate to somebody that they don't know. It just brought hope to, I think, our hospital, our transplant center. And since that first kidney chain, we've done, I think, about 9 or 10 other chains. And that really, and so that first chain was in 2017. And that was sort of the springboard to us saying, this is something that the institution can do and support. And it was just really, it was exciting. It was amazing. Yeah.
Yeah. You guys have a video up there on YouTube, and I love to watch that video. And remind me, it was 9 donors, right, who were able to help 9 other recipients?
Yep. So it was 9 donors and 9 recipients, and we did all the transplants from Monday to Friday. So it was a lot of operating. I did the recipients, and Dr. Maskin did the donors. And with help of our colleagues too. So yeah, it was a lot, but it was pretty awesome.
Yeah, it's an amazing story. For anybody who hasn't seen it, I encourage you to do some research online and go and look up some of those videos and articles that were written about the longest kidney donation chain in Nebraska history. It is truly an amazing story. So Patrick, I'm going to jump back to you a little bit. Tell me what some of the things that you went through in order to be a donor. What was the process like being able to become a donor from start to finish for you?
Okay. The process for me was probably a little different than a lot of people, because right about the time I initially started going through the approval process, COVID hit. A couple months after that, as we were going through things, and everything just kind of stopped, and nobody knew what was going on. And then, 8 months later, we just kind of started up again, kind of had to redo everything. There really wasn't a whole lot of challenges in my case. It was just a matter of showing up a lot of blood work, a lot of, blood draws, fluid draws, checking this, checking that, which actually was really great, because they did such a complete workup on me that I was in much better health than I thought. And it made me comfortable knowing that. But the process for me, other than it being drawn out because of COVID, was actually pretty simple on my end. Show up here, they'll draw some blood. Show up here, they'll do this test. It was just a matter of just making myself available and adaptable to the different times to go in. And thankfully, my family, my jobs, everybody was real supportive and gave me the time I needed to go handle all of that. And then it was just a matter of finding time to schedule it that worked for me, for the recipient, for everybody involved. That was really
Sure.
just logistics put together was the hardest part.
Sure. So you wouldn't say that you faced any struggles or had to like motivate yourself to keep going or anything like that?
No, I was, like I said, I was all in from the beginning. When I found out I was eligible to donate, I was looking forward to it. I was excited to do it. I got told I was crazy a whole lot, and why would I do something? It's not even for family. But why not? So for me, I was actually looking forward to the process. The biggest thing for me was the COVID thing. I would have been really annoyed if 2 days before the surgery I had tested positive for COVID and we had to stop. That was really my only issue, was that COVID was going to derail everything again. But other than that, no, it was a nice fluid process. UNMC, everybody was real accommodating, as to me as the donor, to kind of work around my schedule to make sure it could happen. So from the donor, at least UNMC, they go out of their way to make sure that the donor is taken care of, and can handle their business still and take care of things on their end. So
Sure, absolutely. Yeah, that's so great to hear. Thank you for that insight. I really appreciate that. So Dr. Hoffman, what process do people have to go through if they would like to be considered for living donation? What does the process look like for them?
Sure. So the process starts with an online screening form. So Patrick probably started with an online screening form, and it's a pretty simple and quick screening form. The form then gets sent over to the donor coordinators. And they print out all of the screening forms, and I go through them. For people who are screened out, they're generally screened out because they're generally not healthy enough to donate. They either have a history of diabetes or perhaps a long history of hypertension, possibly a history of cancer. But that screening form involves putting the donor's information as well as the recipient's information in. And then we will call the donors who are screened in at that point. The donors then go through a consent process. The donor coordinators will consent a donor. And that process is about, I think, about a half an hour on the phone or so. It's extensive because we want donors to understand that they can step away from the process at any time, that it's a completely elective operation for the benefit of somebody else. And there's a lot of testing involved, and that sometimes the testing might reveal things that they might not have known about themselves. So luckily, Patrick learned that he was a very healthy person, which is fabulous. But some people may learn things about themselves, like perhaps they didn't know they had hypertension, but going through the process, they learn that perhaps they have pre-hypertension or pre-diabetes or something. So after the consent process is the blood tests, and then coming in for clinic. So clinic is a whole day process where the donors will meet with the surgeon, the nephrologist, the social worker, the psychologist, the independent donor advocate. The independent donor advocate is a really important part of this process. It's somebody that the donor can speak to about anything at all. Asking any questions they might feel uncomfortable asking the rest of the team, or even just saying, you know what, I've gone through this whole day and I'm just not really comfortable with proceeding, but I'm sort of scared to say no. The independent donor advocate works on behalf of the donor to make sure that the donor is coming free of coercion, on their own accord. And then there's testing such as an ultrasound and a CT scan. And then the donors presented at what's called a donor selection conference. And that's when the whole team gets together. We review all of the results of the testing. and determine if a donor is appropriate to proceed for surgery.
So you do that for every living donor. That sounds like a lot of work that goes into that.
Well, yes, it's for every donor, but it's important, though, that we don't cut any corners. It's important that we do the process exactly correct every time, because we're here to protect them. And if a donor should not proceed because of health concerns, it's important that we know that ahead of time.
Yeah, absolutely. That makes a lot of sense to me. Thank you. Patrick, I want to ask you another question. We did a practice of this yesterday, and you said some pretty profound things about what your motivation was to do this and making the world a better place. So can you tell me a little bit more about what your motivation was to go through this process and what, I guess, your worldview is about what it means to make the world a better place and how you feel like you fit into that?
Sure. For me, a lot of people where I am in my life help me out through the year. Teachers, parents, family, strangers, whatever, maybe business connections to get my business off the ground. And I wanted to be able to kind of give that back some way as I go along, try to help people. And there's all this negativity on social media and in the real world, and everybody wants the world to be a better place, and they all look out to other people or to organizations or governments or whatever it may be to make the world a better place instead of just looking in their own backyard. If you want the world to be a better place, you want to be the positive change in the world, do it in your neighborhood, do it in your community. It doesn't have to be an organ donation. It can just be something as mowing the old lady's lawn next door, but you can't complain the world's not a good place and not be the good that you want to see. So it really came down to what better way to pay it forward and help somebody out than help a young lady who has kids at home to raise that might not have been able to see them grow up. So I've got two. I only needed the one. Why not? To me, there was really no downside. Obviously, financials play into that for people with time off for recovery, but a minor hiccup in the road to give somebody a chance at a fulfilled life. You got to be the positive you want to see.
Yeah. I think that's absolutely beautiful. I just love your view of the world and making the world a better place. I think I just love it so much. So thank you for sharing that with me.
No
I am going to ask you a follow-up question. What would you say to somebody who's maybe on the fence or thinking about becoming a living donor or filling out that screening? What would you say to somebody to encourage them?
First, I would say just do it. The amount of fulfillment you get afterwards is amazing. The support and encouragement from family and friends is amazing. And on a lighter note of that, like I actually been telling people, when you get home after your hospital stay, you get 6 weeks of absolute bliss of doing nothing while everybody tells you how amazing you are and waits on you to input. For 6 weeks, I didn't do anything except being told how great I was. I got to watch other people shovel snow, 20 inches of snow from my front door. It was great. Yeah, there was some recovery. I was in pain and it was hurting, but really, a couple weeks of abdominal pain and that was it. For me, there was no downside. I learned about my own medical history, my own medical, my own health currently. I was able to help somebody out. And now I'm just, I'm all in on being an advocate and helping out. I think it's great. So.
Yeah, absolutely. Well, thank you. I think that's wonderful as well. There's just, I love your insight and your input on this process. I think it's really great. Thank you. Dr. Hoffman, I'm going to ask you something kind of similar. Why should people consider being a living donor, or what would you say to people who are considering being a living donor?
Sure, absolutely. So the thing about donors is that they're, extraordinary people, but they're also DJs and teachers and nurses. They're, mothers and fathers and grandparents and children. So we all can kind of be a little bit extraordinary in our own life. And I think, people maybe just don't know enough about it. They've never met anybody who's been a donor. They didn't even know that live kidney donation is a thing. They don't understand the surgery or the recovery time.
Yeah.
And so I think that people are both scared and maybe not necessarily informed about it. But doing things like this, where donors can come forward and sort of talk about their experience, can comfort people and inform them and inspire them to do something extraordinary. And to also know that, gosh, I mean, even extraordinary can live even within myself. So I think if anybody is interested in donation, they should call us or go online, learn about it. I don't want to say that it's an easy process. I've
Sure.
never done it, right? So I don't know how easy the process is, but I do know that the donor team is here to help people through it. So there are multiple steps, but the donor team is here to help people through it, to answer questions, and also to pair potential donors up with people who have already gone through the process. So if people have questions about, I want to donate, but I would also like to start a family. I want to donate, but I'm thinking about being pregnant at some point in time. Is that okay? Or I want to donate, but I'm an athlete. I want to donate, but I'm in college. I want to donate, but I'm 70. Are these things possible? And I just think things and forums like this help people understand who can donate, how the process is, and hopefully inspire them to come forward to help somebody in need.
Sure. Absolutely. I think that's so great that you say what you said in the beginning of your answer about who donors are. They're extraordinary people, but they're DJs, nurses, and teachers, and grandparents, and parents. And I just think that's so profound. I love that so much. Patrick, I'm going to hop back to you, and this is going to be one of the last questions that I ask you so that we have some time for questions. So if anybody online is joining us, if you have any questions, please feel free to type those in the comments, and we'll have a moderator come on in a little bit and make sure to get some of the questions that we have people asking. So if you have questions for either Dr. Hoffman or Patrick, please feel free to type those up, and we can ask them here on this live Facebook feed. But Patrick, I'm going to ask you, what has your health been like, and what has it been like after donation? How have you been feeling, and are you just back to normal? Do you notice anything? What has it been like after donation?
After donation, that first 6 weeks, pretty sore, things were pretty tender, just simple things like sneezing, hurt. You don't realize how much you use your core area for everything. So I mean, just sitting up in bed the first couple of days at home was a struggle. But once a couple weeks into the recovery, you start feeling good. You can move around. You can do things. The biggest thing for me, I feel pretty much back to normal, except I do still have some stamina, energy issues. There's just times I don't feel like I have the full energy I maybe used to, but that'll come with time. There is some issues with my thyroid absorbing the medication, but they don't know what that's from. But so that has nothing to do with the kidney. But other than that, my health is back to normal. I don't have to take any medications. I don't, my lifestyle hasn't really had to change other than drinking more water, which I was never a big fan of, but have slowly become a fan of. But health-wise, I feel fine. I feel good. I added a lot more water to my diet. I drink a lot less energy drinks now. Mainly just to make sure the one kidney I have left stays optimal. But other than that, my lifestyle has not changed. I can still DJ weddings. I can still go out and do stuff. I can still play with my dogs. Life has really returned to normal for me in the health aspect.
Good. That's so good to hear. I'm glad that everything is normal for you, and it's probably a good thing that you're drinking more water anyway, because we could all drink a little bit more water in our lives. So it's probably a good thing, right? Yeah. Dr. Hoffman, one of my last questions for you is if you could think back And I know you're not prepared for this question. I'm kind of just thinking of this off the fly, but I hope that it's an easy one for you. What are some of your most memorable moments in the field of donation? What are some of the things that come to mind of the best parts of your job?
Well, I would say Patrick's a mask in in pre-op was probably one of my most favorite moments of coming here to Nebraska. It was a flashing mask that said something like, "It's the left side," or "If it's the left kidney," or something, as a reminder, like, don't take the wrong kidney. I'm like, thank you. We all need that. That's important. I would say I think it's gosh, I mean, I have so many. The end of the first kidney chain was really special. Seeing donors and recipients in the hallway together is pretty special. I think counseling donors after donation has been an important part of my job. Also, I think, talking people through adverse outcomes, or just when we think everything is going to go okay and maybe sometimes it doesn't. Some of the special times are, I think, when everybody thought maybe I or the donor coordinators were a little bit crazy when we wanted to put together chains. And people kind of thought, like, how are you ever going to do this? But they stuck it out and believed in us. I think seeing kidneys pee on the operating room table is really special. That's probably one of my most favorite parts. There's a lot of different things. I mean, I think our job is absolutely extraordinary. I mean, I don't want to say this too loud, but I'd probably do it for free. I mean, please continue to pay me. I have 3 kids, but I would do it for free. I think just because I get to meet such amazing people. I mean, meeting donors and listening to their stories is just so special. It just inspires us to keep going, especially in times when it seems really tough. When things just don't work out exactly the way that you hoped, you get to come back to clinic and talk to people who say, it's okay. I would still like to go forward and donate. And so I just think there's just a lot of special times with our job, and we're at a really special institution. So that helps a lot.
Yeah, absolutely. Oh, thank you. That was such a beautiful answer. I love what you have to say about all those moments that you get to share with other people. I think that's really great. Kara, do we have any questions that have come through on Facebook that we have a few minutes to answer? Anything that we want to touch base on?
All right. Yes. Can you guys hear me okay?
Yep.
All right. So we got lots of shout outs to Dr. Hoffman from former patients and donors. People love you. And thank you to Patrick from a recipient for stepping forward to be a donor. So that's really special. We have a pretty specific question here, Dr. Hoffman, that I'm going to read to you. It may be something where we would want to follow up, but maybe you can provide a sort of generic answer here. So this is from Monica. She says she's 63. She has a nuclear GFR of 115 and an excellent match for her 30-year-old son. She said she would like to donate directly to her son. Because of only my age, would he be better with a swap from an unrelated younger donor? And how easy is it to quickly find a younger type O donor to swap?
Sure. So, that is a specific question. So what I'll start with saying that, I mean, I don't know anything about your son, but if receiving a live donor is the best course of treatment for him, just in general. So even if he got a kidney from you, that would be better than any deceased donor kidney. But going into exchanges because of size or incompatibility based on blood type or antibodies is not uncommon. I don't want to say it would be better for him to go into an exchange, because it might be time for us to find a compatible exchange. And maybe, and under some circumstances, it would be best if he was transplanted in general. So yeah, that's a pretty specific question. We do get that question a lot, whether age would require somebody to go into an exchange. Age does not on itself require somebody to go into an exchange, but we do look at every case individually. And if we feel like we could benefit your son by putting him into an exchange, that is something that our team would probably do. But if we would not be able to find a younger donor for him, it's best if he receives a kidney from you rather than going on the deceased donor list and waiting for a kidney from a deceased donor.
Great. Another question from Tony. She says, what do you tell a person if they may wish to donate but are concerned that they may need both of their kidneys in the future?
Sure. So that's a good. So the donor process is very stringent in that it requires a lot of testing in terms of blood work, ultrasounds, CAT scans, and sort of calculations of patients' kidney function. We look at past history related to high blood pressure or diabetes, obesity, and try and educate the donor the best we can as their potential risk of donating and the need for them to, or the potential for them to have chronic kidney disease in the future. So I would tell people that if they're interested in donating, start the process. The process tends to figure itself out, and that if you're not an appropriate donor, the process will find that out quickly and you will be screened out. And if you are healthy enough to donate, what the process tells you then is that your likelihood of requiring dialysis or ending up with end-stage kidney disease after donation is exceedingly low, and that you are likely safe to donate and live a normal lifespan with a solitary kidney.
Great. Another question for you, Dr. Hoffman. Is high blood pressure a factor that would rule someone out for kidney donation?
So that's a good question. And that relates a lot to age of onset of hypertension, and how many blood pressure agents a patient or a donor is on. So if your high blood pressure was diagnosed before the age of 50, you are not eligible to donate. Okay. If you have later onset hypertension, like let's say you are a 60-year-old donor and you were diagnosed with hypertension when you were 57, and your hypertension is controlled on a single blood pressure agent, then I would say that is not, that in and of itself would not rule you out as a donor. And so that person would still, I would encourage them still to come forward to attempt to donate. Yeah.
Great. A question from Sue. She says, how many people were in the longest kidney chain at Nebraska Medicine? I think she knows that answer because I think she was part of it, but.
Oh, is this our favorite? Yeah. So there were 9 donors and 9 recipients.
Excellent. So encouraging. I think that was the last question that we had submitted. I wanted to ask one though, Dr. Hoffman. Patrick mentioned that there can be something people would need to consider is time away from work and maybe the financial impact that would have on them. I believe that there are some resources out there for living donors for that. Can you talk about that?
Yeah, absolutely. So recently, unpaid wages related to time off from work is now compensated. The government has passed very specific things that allow for live donors to be compensated for time off. I think when Patrick donated, that was not available, perhaps. But so this is something new. There is also compensation for time and travel. And there are some specific considerations to that, but our coordinators can help patients through that. They can explain the paperwork and the qualifications for those things, which I think are incredibly important for people in our state. We have a lot of donors who come forward who are self-employed, and so they need compensation time for the time off. We have plenty of donors who are farmers who also have asked a lot about help and compensation. So I believe, and I think anybody who has a passion for live donation believes that donors who come forward to donate a life-saving organ for the benefit of another person, and actually for all of healthcare, should not be worse off because of that choice. So our transplant center helps people through that process. So if anybody is thinking about donating, but they're worried about the travel, the time off, the resources available to help, they should still reach out to us and we can talk them through all of those things. That's a really important question. And unfortunately, I think that's also a reason why people do not come forward to donate, that they're concerned about those things. Yeah.
Great answer. That is all the questions that we have.
Okay, well, thank you everybody so much for joining us. It was so great to be here with Dr. Hoffman and Patrick. Thank you both for your time. It was really great to hear from both of you. I thought you both had some really inspirational things to say, and I just want to say thank you to everybody who joined us on Facebook Live. It's been great to be with you over the lunch hour, and I hope that you have a wonderful rest of your day.
Thank you so much. And
thank you for having me. I appreciate it. You're welcome. And I brought the mask just in case.
Oh, you did. So you have to show the mask. Let's see it. Now you.
Okay, I have to ask a question now since we brought that up. Patrick, what is the best wedding song to play and what's the worst wedding song to play?
That's awesome.
That's amazing, Patrick.
This mask has been my lifesaver during COVID.